Which of the following is essential to minimize artifacts during an EKG procedure? So the EKG procedure is the procedure where you have the stickies or the leads that are on the patient, and they're all attached to the monitor to get the rhythm of the heart, which normally would look something like that, to see how the heart is contracting and pumping, to see what their rhythm of their heart looks like. However, if you have artifacts, the rhythm may look a little more something like this, and that doesn't mean that something is wrong with the patient's heart. It just means that it's picking up extra movement onto the monitor that shouldn't be there, so you're not getting an accurate reading of the patient's heart rhythm. So let's see, based on these choices, what should be done to minimize these extra movements or anything being picked up onto the EKG that shouldn't be picked up in order to get an accurate result. So option A says ensuring proper electrode placement and skin preparation. And that makes sense because you want the skin to be prepared properly so that the EKG leads could stick, because if they're not sticking and some of them are coming off, you're not going to get an accurate reading on the heart rhythm. And also the electrode placement, if they're not placed in the right spots, then you also would be picking up extra movement or anything else onto the EKG that shouldn't be there, and then you wouldn't get an accurate result as well. So option A is looking correct. But let's go through the other choices. Option B says having the patient talk during the procedure, and no talking would cause extra movements, which would lead to extra artifacts, and therefore that's not correct. Because remember, this question is asking for ways to minimize the artifacts. This isn't an opposite type question like when they ask for not. So option C says increasing the room temperature, and that shouldn't affect the results. That's not necessary. And then option D says using expired electrodes. Now be careful here. We don't want to use the expired electrodes. We want to use electrodes that are not expired so we get more accurate results. So we can eliminate option D. So option A is correct, ensuring proper placement and skin preparation.